Again, we are going to discuss 5 most important and potential MCQs from pediatrics for your upcoming NEET PG exam. So let's focus on the first MCQ. What is the total fetal cardiac output? So see students, there are 4 options given: 150, 250, 350 and 450 ml per kg per minute. So basically this is a factual question and your answer is 450 ml per kg per minute. Okay, this is the fetal cardiac output. Okay, and the neonatal cardiac output is 350 ml per kg per minute, and the adult cardiac output is 75 ml per kg per minute. So basically, here it is only fetal cardiac outputs has been asked, but you may be asked the neonatal cardiac output as well. So here the answer is definitely option D, 450 ml per kg per minute. Clear everyone? Now moving on to your second MCQ. So what is the mode of inheritance of hemophilia C? Okay, so you see the options. It's X-linked recessive, X-linked dominant, autosomal recessive and autosomal dominant. So let's start with hemophilia A. Okay, all of you are knowing this is what? X-linked recessive. Okay, this is due to factor 8 deficiency. Clear? And where does this lie? On chromosome XQ28. This may also be asked. Okay, next, hemophilia B. This is also your X-linked recessive and this is due to factor 9 deficiency. Okay, this is also known as your right Christmas disease. Okay, next moving on to hemophilia C. This is an autosomal recessive disorder due to factor 11 deficiency. Okay, so the answer for this is option number C. Clear students? Now moving on to the third MCQ. So you see, look at the options. This is a pictorial question. Okay, and the question is: a newborn presented to emergency with abdominal distension. The X-ray of abdomen shows the image depicted below. Identify the most reliable diagnosis. This is basically a straightforward question. Okay, so first you try to focus on the X-ray. Okay, and already the this thing clue have been given to you: abdominal distension. This is a newborn. Okay, so read the question mindfully. Okay students, so here you see what is there in the X-ray. It's showing a bubbly like appearance, right? So this is, and you see the options. Look at the options: intestinal obstruction, malrotation, meconium ileus and necrotizing enterocolitis. So basically what will be the answer? This is a case of NEC. Why NEC? Because you can see pneumatosis intestinalis. Okay, what is that? The gas shadow in the along the bowel wall. Here can you appreciate students? Yes. Okay, you can appreciate the gas shadow along the bowel wall. Okay, so this is the pathognomonic sign of NEC, mind you. Okay, and as per Bell's staging, okay, this is coming to be stage 2A. Okay, in your ionized set exam you may be asked this type of question. Okay, and if it's a straightforward like in NEET PG, you may be asked just the diagnosis. Okay, next, what are the features of NEC? Okay, so the child may present to you with distension as already mentioned, and hematochezia. Okay, that is fresh blood in stool, and there will be hyponatremia, thrombocytopenia. Clear? So that's all about NEC. Okay, the MCQ part of NEC. Okay, next, moving on to your fourth question. So that is, which of the following is the next best step in breastfeeding jaundice? So read it properly. This is breastfeeding jaundice. Okay, so what is breastfeeding jaundice, students? Breastfeeding jaundice occurs due to inadequate breastfeeding. Okay, so inadequate breastfeeding leads to lesser bilirubin elimination and increased enterohepatic circulation. Okay, what you need to do here is just increase the breastfeeding. Okay, you don't need any further treatment generally. Then you often get confused between breastfeeding jaundice and breast milk jaundice. So breast milk jaundice, what happens is there is a certain substance in the breast milk called pregnenolone. Yes. Okay. So basically it is 3 alpha 2 beta pregnenolone. Okay. What it does, it interferes with the bilirubin conjugation. Okay. So here the serum bilirubin might increase to more than 15. Okay, thus sometimes needing phototherapy. But don't jump into answers without reading the question mindfully. So here it's written breastfeeding jaundice. So what is your answer? Increase the breastfeeding. That is option number B. But had it been a case of BMJ, would have been the option number A. Clear to you? So moving on to the last MCQ of the day today. So that is once again our pictorial question. Which of the following procedures is performed in the chest X-ray depicted below? So students, basically this is not a direct question. Okay, already one X-ray is there. They are not asking you the diagnosis, rather they are asking you what is the surgical procedure that you will be doing in this particular disease. Okay, so they are assuming that you are knowing this disease. Okay, so what is this? What are you finding from the chest X-ray? Are you being able to appreciate the heart shadow, cardiac shadow? Yes. So this is appearing to be like egg on shell appearance. Okay, and where do you find the egg on shell appearance? Of course, TGA, that is transposition of great aorta. So what students you tend to do, that is by seeing this type of question, you jump on Blalock Taussig shunt, BT shunt. Why? Because you are majority of you are knowing only this. This is done in case of what? TOF, tetralogy of fellows, right? All of you are knowing this, so you feel this is going to be your answer without seeing the chest X-ray. Okay, so this is Egon shell, and here what do you get? Of course, boot-shaped appearance. Okay, right? Okay, so Egontian appearance, you will be, what is your diagnosis? This is a case of TGA. And what is the surgery of choice in TGA? This is nothing but Jetton's arterial switch. Okay, so where are you going to do the other, let's see the other options. Where are you going to do modified Fontan operation? Okay, this is done in case of tricuspid atresia. Okay, and Rasteli is done in case of DORV, that is double outlet right ventricle. These are good to know things. Okay, so guess this video was helpful to you, and I'll be coming up with lot more MCQs very soon. So thank you.